Hello, everyone. It's Dr. Lisa L. Campbell. I am here with your week one lecture for Introduction to CPT and HCPCS coding. As indicated in the course syllabus, you will need a copy of the AMA 2025 CPT manual. You will also need the HCPCS manual. Of note, we're not really going to get into hick picks until week number 8, our last week. And so if you're short on cash and, need to delay ordering the book, you can definitely go ahead and wait. So, one of the things that I like about this second semester of your 3-semester coding program is that by now you really understand the concept of coding, right? You know what coding is all about. You understand the importance of getting to know your manuals, proper use of the manuals. So, this is your last intro class before you go to the intermediate coding class. And so, this typically is an easier class for students to navigate. This lecture is part one of two parts for week number one. In week number one, we're doing chapter one, which is an introduction to CPT, and then chapter two, which focuses on modifiers. Objectives. So, one of the things that I think is very important for you to understand is that the reason that there are objectives at the beginning of the chapter is because you need a visual understanding of what you're expected to learn by the end of the chapter so that as you're going through the chapter, you can make a mental note of these things. So you should be able to do 6 things at the end of today's session. Number one, explain the purpose of CPT. Number two, understand some history regarding the development and how often CPT is revised. Number three, you should be able to summarize the format and the contents of the CPT manual. Four, interpret the symbols and punctuation. And you had some conventions in ICD 10, so this should not be anything new. Number five, locate a CPT code in the manual and then differentiate between level one and level two codes in HCPCS. So let me state something that is typically confusing, and that is level one and level two of HCPCS. I want to tell you right now that level one of HCPCS are the CPT codes, and level two are the actual HCPCS codes in the HCPCS manual, which are also known as national codes. We'll talk about that in a little bit more detail, but I wanted to just do that quick call out because that's always a confusing topic. So, the CPT manual for the AHIMA exams, you are required to bring the AMA CPT manual. I bring that up because Optum has a CPT, I think it's called CPT Expert. I haven't seen it in a few years, but for really all of your national coding exams, you have to have the AMA version. So, CPT is owned and copywritten by the AMA. They're located here in the Chicagoland area, and the CPT code set is updated annually. To put into perspective how CPT differs from ICD 10 CM, CPT shows what happened today. ICD 10 CM, the diagnosis, is the why. And let's just throw in HCPCS HCPCS shows what was used when applicable. So you know by now that coding is the process of translating words into numbers. And in the case of CPT, we're talking about turning the words into a billable service. Just like all other systems, you have to understand medical terminology. There will be words in the CPT manual that you don't know what they mean. As usual, you should look them up. On the day of your AHIMA exams, you cannot bring a medical dictionary, so you need to bring the knowledge with you to the testing site. CPT codes are accepted by insurance companies to reflect the services that were rendered. But here's something to note. Just because we have a CPT code for something doesn't mean the insurance company is going to pay for it. CPT was established in 1966, and it was established to report physician services. And if you think about it, AMA, American Medical Association, is the association, one of the associations for physicians. Now, today, I'm pretty sure you know, we have more than physicians that can bill for services. So, for example, you have physician assistants, you have nurse practitioners, and so they too can report CPT codes. Since the creation of the CPT code set, it has been identified that this system can be used to report outpatient hospital services. You will see why shortly. And then the first version of this manual was really small, and you should be holding the CPT manual in your hand, and you know it's not a pocket size. When CPT was first created, it consisted of 4-digit codes with very brief descriptions. Today, we have 5-character codes, and the descriptions are sometimes brief and sometimes not brief. All right, so today, what we have in the CPT manual, in the main portion of the manual, are what are known as sections. The sections are further subdivided into subsections. And then in the subsections, you have subcategories with headings. End result, thousands of codes. Updated annually, January 1, that is the date when we are expected to use the new code set. In generally, and I have to say this varies over the last couple of decades. Um, I've gotten my CPT manual as early as late September, top of October, but the updates are released from the AMA in the fall. The release of the updates are provided in the CPT manual. You can't necessarily go online and download a file of the changes. You can purchase a copy, but they are generally released in the fall. Something else to consider as you are preparing for your certification is that after you're certified, you have to get CEUs to keep your certification. If you fail to get those CEUs, you have to retake the exam if you want to um, keep your credential. So every November, the AMA has a CPT and RBRVS symposium. RBRVS, Resource Based Relative Value Scale, is the reimbursement methodology that determines how physicians are going to get paid. And you are going to be relearning, and I say relearning because last semester you had inpatient billing and reimbursement, and in the textbook that you had, there was a section on the prospective payment systems, and RBRVS was one of them. This semester, you are in the inpatient or outpatient billing and reimbursement class, and so you will relearn some things that you've already learned with the goal of really getting you to the place where you can apply the concepts. So this symposium is generally about, I think it's about $800. I haven't been in the last, I would say, 2 years. Used to be face to face, and since the COVID-19 pandemic, it is virtual. But what happens is you get to hear about the changes directly from the AMA with rationales for the changes. The changes are usually presented by physicians in different specialties. So, for example, if we got some new pathology codes, someone from the Pathology Association would present the changes. In the CPT manual, there is an appendix that basically gives you a list of additions, so new codes, deletions, and revisions. And that is again in one of the appendices. I'm not going to tell you which one because I want you to take the time to review the manual. All right, so let's talk about the structure of the manual. So, in the inside cover of the manual, you see what are known as modifiers. Again, part two of this lecture will focus on modifiers. And so once you actually get into the, I call it the meat of the manual, the 6 sections, each section is preceded by an introduction to that section. But before you even get to that, there's an introduction to the manual itself. Then you have the core of the manual, the appendices, and the index. So I know you're thinking, whoa, the index is in the back? Yes. So unlike ICD 10 CM, ICD 10 PCS, the index for CPT is in the back instead of the front. As we continue throughout these weekly lectures, I would highly recommend that you listen to each lecture more than once because sometimes you miss something. And so you listen again and you can pick up on it. All right, so let's talk about the sections of the CPT manual. And when we talk about sections of the CPT manual, we're talking about what is known as category one. I should also mention this lecture is not a substitute for reading the chapter because you do have homework and exam each week. And there are going to be some things on there that are not necessarily covered in this lecture. All right, so I mentioned earlier that each of the sections, the 6 sections, begin with an introduction to that section. They are known as guidelines. So there are 6 sections in the CPT manual: evaluation and management, anesthesia, surgery. Each of those are preceded by the guidelines. And then the remaining 3: radiology, pathology and laboratory, and then the medicine section. So before you assume that the medicine section is about medication, let me just tell you that it is really everything they couldn't capture in the first 5 sections. They threw it over in the medicine section. And then, wait for it, HCPCS actually consist of services that were not captured in CPT. There are some services that appear in the HCPCS manual, which we'll talk about later, that are also in the CPT manual. And that is because Medicare or Medicaid has mandated the use of those codes instead. So, as we navigate CPT HICPICS the next 8 weeks, one word of wisdom that I will give you is that you should first listen to the lecture. Second, read the textbook chapter because you will say, "Oh, I remember hearing about that in the lecture." And then go through the exercises that are in the book before you attack the homework and the exam. Remember, on the day of your exam, the CCS or the CCSP exam, you are going to be tested on three cognitive skills: knowledge, comprehension, and application. And one of the ways to be able to do that is by repetition, by really digging into the material. All right. So then after category one, and category one has 6 sections, you then have category two and three codes. Category two codes are actually for performance measurement and quality, while category three are codes for emerging technology. And basically, that's just a fancy word for a new way of doing things. So, an example I can give you is back in the day when patients got hysterectomy, for example, it was done via an open approach. Well, then the concept of an endoscope was created. Endo means to look within. And so instead of having to cut open patients from one side of the abdomen to the other, the concept of a laparoscopic procedure came into play. And so endo is just a broad term for looking within. The name of the scope is going to be based on that body part. So category three is that latest and greatest way to do something. One thing about category three codes, they typically will do one of two things. They will appear in category three after they are approved. And if they are widely used, they will potentially become a category one code, or after about 5 years, they fall off if they're not being used. All right, so then after that, we have the appendices. There are lots of appendices. And then, of course, we have the index. The index is where the coding process begins. So let's pause for a knowledge check. Which organization is responsible for CPT codes? And I know that you know that answer, and that is the American Medical Association. All right, so the introduction to the manual itself, and I want to be very intentional with my wording. The introduction to the manual itself discusses some foundational information regarding the system. So it gives you the different sections, which you know what they are now. It gives you the code numbers for those sections. It tells you how to use the book, the format of the book, how a request can be made to update CPT, the application requirements. It gives you the criteria for inclusion as a category one, two, or three code, and then basic category specific requirements. In the introduction, they also talk about guidelines and a type of code that is known as an add on code. And very simply put, an add on code cannot be used alone, it has to be added on to something else. Added on to something else. Okay, um, modifiers. Modifiers, which we'll talk about in part two, are added to a code to show something has changed today about the code itself. So the description remains the same, but something was altered. Then we have place of service and facility reporting. And those are actually, if you look in your CPT manual, they're actually located in the inside cover of the CPT manual. And the place of service is for the claim form to tell where the service was rendered. So, like 11 is outpatient, 21 is inpatient, so forth and so on. In our billing course, you will have an opportunity to see the claim form and the place of service, and so it will all make sense. Then there is a discussion regarding unlisted procedures or services, followed by results, testing, interpretation, and report. Lastly, in the introduction, and you probably are thinking, whoa, that's a lot. It really lays the foundation, right? So then the next thing is we talk about the special report, which is used when we have an unlisted code, and then the concept of time. And CPT has many definitions of time. And so that little section will give you an introduction to that. Then the CPT manual has symbols, which are located at the bottom of the pages in the CPT manual as well as inside of the inside cover. Then there is some discussion regarding the alphabetical index, how we use it, which we'll get into that shortly. Then basically some piracy regarding the CPT code book. AMA owns CPT, point blank, period. CPT is available in electronic format. They talk about that and then references to AMA resources. And so, one of the resources I'm so excited that you are going to be exposed to before you graduate is the AMA CPT Assistant. And this will make sense when you really start to dig into the manual because you'll see that there are some codes that make reference to a CPT assistant. But here's the thing about CPT assistant, it's available, but it's not free. But it is something that you will be accessing before you graduate. All right. So these symbols are designed to, the symbols are designed to um, provide information about the codes themselves, but you don't add the symbol to the code, right? So these symbols will tell us things like, oh, it's a new code for this edition, or for this edition, the code was revised. So be sure to look at the different symbols and identify their purpose. All right, give me one second. Okay, so the main section, the 6 sections of Category 1, you know what they are: evaluation and management, anesthesia, surgery, radiology, path and lab, and medicine. And you probably are asking yourself, why does E&M start with 9 and then medicine starts with 9? And why is it in the front instead of the back? E&M is up front, it's the most widely used, and so it is listed in the front. And then right after that, you will see the remaining of these sections. And one of the things that I want to just call out is basically what's going to happen over the next 8 weeks. We're going to climb through these 6 sections. So we start off really slow with this introduction this week. Next week, we go big or go home with evaluation and management coding. And then we just continue climbing all the way to week 8, where we will then discuss hick picks and we will be done. So let's talk about the surgical section. The surgery section is the largest portion of the manual. And when I think about the chapters for our textbook, I think there are 15 chapters on surgery. We will cover them across 3 weeks. So that kind of gives you some insight into how you're going to need to manage your time. But inside of the surgical section, you're going to find these subsections that are organized anatomically. So we go from integumentary system to musculoskeletal system to respiratory system to cardiovascular system to digestive, the list goes on. So each section is arranged by the anatomical site, and I would encourage you to just spend some time looking around because you'll see the color coding of the anatomical site, right? So, like, let's say you're in the respiratory system, you're going to see codes for the mouth, you're going to see codes for the lungs, you're going to see codes for the bronchus, right? So, it's really organized first by anatomical site. And then once you get to the correct anatomical site, you got to get the correct procedure. Remember, I talked about the open um, procedure versus the endoscopic procedure. So within the code families, you're going to see that offered, and you don't want to make a mistake and say, oh, it was open when it was really endoscopic. So you have the procedures, you have the description. The system does take a head to toe approach. And what I mean by that is when you get to the organ or get to that anatomical site, it's going to start at the top and then work its way down. The other thing that I wanted to mention, remember how I said there was an introduction or the guidelines in front of each section? Well, within the section, we have two other types of notes. You have subsection notes, which apply to that subsection. And then you have what are known as parenthetical notes, which are essentially notes that are in parentheses. What I will tell you is that now is the time to read through those notes because 8 weeks goes pretty quickly, as you know. And you don't want to be in a situation where it's now time for the exam and you're just starting to read those notes. Okay. All right. What else we got here? Okay. So here's an example of a subsection. So main term surgery, sub or main section surgery, under surgery, the integumentary system, which is a subsection, and then you have the sites, and then the actual procedure in this case is incision and drainage. But in this particular area, you got excision, you got destruction, right? So very important to review and understand the documentation so that you can select the appropriate code. All right, next up, knowledge check. Name the 6 sections of CPT. I know you know this answer. Evaluation and management, anesthesia, surgery, radiology, pathology and laboratory, and then medicine. And these 6 sections comprise category 1 of the CPT code set. I'm not talking about HCPCS right now. Category 1 of the CPT code set. All right, so there are multiple symbols that are in the CPT manual, but one that is worth noting is the semicolon because it tends to be the symbol that is confusing. So, number one, there are essentially two types of codes that you're going to see in the CPT manual from a format perspective. You have a standalone code, and then you have an indented code. And in the situation where there is an indented code underneath a standalone code, the code set uses a semicolon to basically conserve space. And I want you to stick with me. I have an example because this is a concept that you really got to wrap your head around. So let's continue. So in the CPT manual, and it's not indented on this slide, but in the CPT manual, it is 180, 181. 180 is incision and drainage of a pilonidal cyst, simple. But then 181 just flat out says complicated. Complicated what? Well, whenever you have an indented code, you will read the description of the standalone code, which may not be directly above it. It could be 10 indented codes in a family. Again, you'll see that as we begin to code. But basically, what happens, you're looking at an indented code, you go back up to that standalone code, you read the description up to the semicolon, you stop and drop back down to your code. So 180 is an incision and drainage of a pilonidal cyst simple. 181, incision and drainage of a pilonidal cyst complicated. Now, one question that's coming to mind for you right now is, do I report both of those codes? No. Based on your documentation, you're going to select either the simple or the complicated. So I've already talked about this, but basically, that standalone code is going to give you that full description, and then you're going to drop down to pick up the part for your code. There are options where the procedure can be done on, different nerves. And so what happens is that you have the standalone code, and then you have all these different nerves. You pick the one for your patient. You will have lots of opportunities to practice that, so not to worry. All right, guidelines, guidelines, guidelines. I talked about this, right? Guidelines are at the beginning of that section, and they are specific to that section. And then within the section, you have subsection notes, parenthetical notes. You even have some coding tips, right? These guidelines are to be followed. So, again, it is critical that you read them real time. Don't try to, and I'll just give a perfect example. Once this class is over, you're immediately going into intermediate coding, right? And so, in intermediate coding, you don't have a textbook. All you're going to do is code. And so, you need to bring those guidelines forward. All right, the appendices, they are at the end of the book, but they're located before the index. They are letters A through T. Appendix Q was deleted, and lots of great references available for when you need them. One in particular is Appendix A, which is going to give you the full definitions of the modifiers. In the inside cover of the CPT manual, you're not going to get the full description. You just get the number and the title. Appendix A is where you can dig into the titles or the description. All right, so the index. And this is where it's time to locate a code. So let me get my manual out, and it's heavy. So first off, the index is in the back of the manual, and I'm not going to give you the page number because you should have the manual, because it is week 1 of our class, and the manuals that were needed were known to you before classes started. All right, so the index is organized by main term. And if you're looking in the index, the main terms are in blue letters. So, for example, the first one, and I don't have my glasses, so I know abdomen is there. It's not the first one, that's the second one, but that is the main term. It is very important that you start at the beginning of the main term so that you can index the options properly. So, for example, and don't laugh because I don't have my reading glasses on. I don't know where they are, so I'm trying to see. All right. So if you notice, under the main term abdomen, there is a subterm of, let's see. I want to go down for a reason. Um, let's see, catheter. So abdomen catheter removal. It gives you a single code of 49422. And just like all other systems, you can never, ever, ever code directly from the index. All right, so abdomen catheter removal 49422. Then I want you to look at abdomen abscess. Under abscess, incision and drainage, you see open, and you see 49020, comma 49040. What that means is it's either this or that one, but you gotta go look it up. And then you see, I'm gonna go back up just a tad bit, under abdomen, abdominal wall, and then go to tumor excision, and you see 22900 through 22903, and that's a hyphen. That is a range of codes. So why am I telling you all that? The index is providing you with either a single code, a code that has a hyphen, which is known as a range of codes, or it's a either or situation. All right. Keep that in mind. Hold that in your back pocket for a second. When you are in the index and you are trying to find a main term, keep in mind that CPT has four options for main terms: procedure or service, organ or anatomic site, condition, synonym. That means you can use all of those different ways to look up a code. Is there a magic list? No, you have to just trial and error. So remember I said the importance of your flow for the week. Listen to the lecture, read the textbook chapter, do the questions on the inside of the chapter, then do your homework, then do your exam, because you'll get more out of it. So, I already told you about this, and now you get to see it. So, the main term can be followed by up to three indented terms that modify the term. You just saw that. And some entries give you one code, some give you a range that's separated by the hyphen, and then the other could be separated by a comma, either or. So we always verify the codes in the main portion of the book 100% of the time. All right, knowledge check number 3. State the purpose, two purposes of the semicolon. And I like to say that they basically are saving printing space, right? Because they can't reprint that same line over and over and over again. The book would be huge. You would need a wheelbarrow to carry it if they didn't use this format. And so it assists in making the proper code selection. So remember our example of simple versus complicated. And then it separates the main term or the common portion from the additional options. I recommend you spend some time looking at those options in the manual um, just to really get that understanding, the visual. All right, so now we'll talk a little bit about HCPCS. HCPCS, the Healthcare Common Procedural Coding System, was developed, I think, in 1983. I'm pretty sure they talk about this in a textbook. But basically, it was to capture services that are not in the CPT manual. It was created by HCFA, or I spelled that wrong. I said HFMA, but it's HCFA, HCFA, which is now known as CMS. HCPCS has two levels, and you already know this level, right? So, level one is CPT, and CPT has those three categories: category one with the sixth section, category two, which is for that performance measurement tracking. Category three is that emerging technology, latest and greatest. Those are also known as temporary codes. Why? They either become a category one code or they go bye bye. They sundown. All right, then we have the actual HCPCS manual, which these are also commonly referred to as national codes. They are published annually. It captures services not in CPT. This is not owned by the AMA. So actually, you could find the entire file of codes on the CMS website. But keep in mind, for national exams, you got to bring the HCPCS manual with you. All right. Knowledge check number 4. Which organization develops CPT? You know that. AMA, American Medical Association. Knowledge check number 5. Where can the level 2, aka national codes, be found? And you know they are on the CMS website, but you will need the physical manual um, for class as well as when you go to take your national exam. In particular, if you're going to take the CCSP, you will have to bring the manuals. And I should call out if you show up without the correct manuals, you will be turned away. And so that is why all of your manuals are the 2025 version. And you all will be completing your program July 2025. And my wish for you is that you test in August. Go right in because you'll be ready. All right. So, guess what? We are at the end, and basically, we are ending where we are starting and where we started, which was our 6 objectives. And that is all of this part 1. I will do a part 2, which focuses on chapter 2 on modifiers. Thank you.